Good afternoon and welcome. Can you hear me? Welcome to the 2019 Santa Barbara County Employees Retirement System Open Enrollment Session. We are very glad to have you here today. We have a lot of information for you about your insurance coverage and the benefits that are available to you through SB CSRS. Before we get started, I wanted to do some staff introductions. Seated right here to my right from our member services team is Arika Kajaturians. She works in our Santa Barbara office. In the back of the room, Jenny Labastida and Scott Dunlap. Our Assistant Executive Officer, Brian Richard. Where is Lauren in the room? Lauren, where are you? There's Lauren in the back. Lauren Thompson is Assistant Executive Officer in Santa Barbara as well. And our Executive Officer, Greg Levin, is with us today. Okay, so as a reminder, you probably saw it on the sign when you came in, we are videotaping this session. So if you've got your cell phones, please set them to silent so we don't have to edit out video sounds. And also, just as another reminder, if you are a firefighter, we do have rates here for you, but the firefighters have their own open enrollment session. They held it last week. Their open enrollment runs at the same time as ours. It ends on the 31st of this month, as does ours. So if you have any questions, you can contact the Benefit Service Center, and they're in the back of the open enrollment book as well. Do we have anybody in the room who has COBRA? I have your rates. In the lobby, we have the rates for both court and county or COBRA rates, okay? So all of our benefit representatives who are here today will be available to you at the end of all the presentations for questions. So we ask that we hold questions to the end. And the big question that everyone asks every year at open enrollment, I'm not making any changes. Do I need to do anything? You don't have to do anything. The answer is no. Sit back, enjoy the show. If you do have changes to make this year, we can take your forms today. We have a bunch of forms in the lobby. You can either pick them up and take them home with you, fill them out and bring them to our office. You can send them snail mail to us. You can scan them and send them to us by email, or you can fax them to us, and all that contact information is in our book. Okay, so without any further ado, I want to turn it over to our Executive Officer, Greg.
Thank you, Rebecca. Can everybody hear me okay? Oh, great. Well, thank you all for coming today. I really enjoy coming to these seminars, and I really appreciate the time that you take to come down here and meet with us today. It's one of the few times a year that we actually get to spend a little time with you guys outside of your retirement counseling sessions, and so these events are very important for us. They allow us to stay connected to a community that's very important to us. This year I'm doing a little bit of a presentation because we thought it would be helpful to give you guys information about your healthcare plan outside of just what your insurance options are. And so I have a couple slides to show you, and I'm just going to walk right through them. And the slide right here that I've just put up on the screen shows the asset balances of your healthcare plan. And what you're seeing from this chart is exactly what you want to see from a chart with bank account balances. It's going up. And over the last 5 years, we've been able to work with the county to develop a funding plan for your OPEB benefit. In 2013, this plan only had $2 million in the plan. And to give you some context, we pay out about $10 million per year to retirees for healthcare benefits. And so we were, in terms of a household budget, we were living check to check on this plan. We'd give you guys your monthly subsidy, and then we'd ask the county for more money to fill up the bank account so that we could make next month's payment. Well, starting at about 2013, 2014, we developed a funding plan with the county, and I'm very pleased to say we now have $18 million in the plan. So we've gone from having less than a quarter's worth of benefit payments in the plan to having 2 years of full benefit payments saved up in the plan. And what you can take from that is that your healthcare benefits are secure and getting more secure as time goes on. And I think that's very important for our retiree community to know, and that's why I wanted to share this information with you today, that the county is committed to funding this benefit, and that is a good thing. And so we just wanted to share that information and give you that confidence as you stand here looking at your healthcare options today. The next slide I want to show you is, and if you are already getting our monthly newsletter, you see this chart on the screen every month. But what we do is we track your COLA now on a monthly basis, and we send that out in our email newsletter every month. And if you haven't already signed up for the newsletter, I really encourage you to contact one of our benefit reps and ask how you can sign up. Just give them your name and who you are, and they'll actually sign you up. And you'll start getting this monthly newsletter. It's going to come, the next edition of it's going to come out next week. It generally comes out 1 or 2 days before each board meeting of the Board of Retirement. And in this newsletter, we provide you with a monthly update on what the COLA is looking like. And right now, if you look at the chart, you'll see that the COLA is currently estimated to be 4% this year. This COLA is derived from the CPI index number that comes out of the Los Angeles metropolitan area, and it has been very strong this year. This is the first year that we've seen it higher than 3% for several years. But one important thing I wanted to take away from you, want you to take away from this, is that your COLA is actually capped at 3%. And so if we come into the end of the year at a 4% increase, what's going to happen is your payment will go up by 3% in May, starting with the May 1 payroll. But then that extra 1% will go into a bank for you, and it will be set aside for future years when your COLA is less than 3%. So, for example, if inflation is 2% next year, then we'll have that 2% inflation, but we'll take the 1% extra that you earned this year and we'll add it, and you'll get 3% next year. And this is really important for you to know, because actually I think you have to have retired prior to 1983 now in order to have any residual COLA bank left in your account. And so this is going to be the first year in a long time that many of our retirees have had a little bit set aside for future COLA increases. We're very happy to see that. We fully recognize that your income security is very important to you. This is part of how your pension benefit is protected, and that your income security is protected over time. The next slide I wanted to talk to you about is some improvements that we've been working on. In 2017, we instituted a process of giving people who are taking the $4 HRA benefit, which I'm guessing that many of you in this room are actually getting the $15 benefit. That's why you're here to learn about health insurance options. But if you are on the $4 benefit, you can now have a credit card sent to you that allows you to use that $4 credit to your HRA at the point of sale. It used to be that you would have to spend the money, collect the receipt, and then mail in a packet and get a reimbursement check sent to you. Now you have a credit card that you can use to access that directly at Rite Aid or CVS or your doctor's office when you're spending that money. That was a service improvement we did in 2017. In 2018, if you've called us in the last week or so, you may notice that we've put in place what's called an automated call distribution system. Our goal with this call distribution system is to get you guys to a living, breathing, responsive customer service representative as quickly as possible. It's not to route you to a voicemail. It's actually to improve our service delivery to you and make us more available to you. So now we have staff that have designated times where their job is just to sit there and answer phone calls from our member community. We think that's a big improvement. We were struggling with people having to leave voicemails and then wait a couple of days to get a call back. And so we're working on that now. We've been live for about 2 weeks. As with any new system, there's some pluses and some minuses. We're still working out the kinks, but we really appreciate your patience with us, and we're optimistic that we're going to see improvements, rapid improvements over the next year. It allows us to really measure what we want to manage, which is how long it's taking for our retirees and our active members when they call us. How long does it take for them to get from dialing that number to a real live person that can answer their question? And so we appreciate your patience, but we think that it's going to be an improvement over time. And then the next thing I want to talk to you about is in 2019, it's going to be a big year for us at SB Service for 2 reasons. The first one is that we're going live with our new benefits administration system, which means towards the tail end of the 2019 calendar year, you're going to start being able to do account management operations online. So you'll be able to go online and schedule an appointment to meet with your benefit rep. You'll be able to go online and develop, fill out a change of address form and submit that, and things of that nature are going to be available to you in the coming months. And we're really excited about that because we think that's another thing that's going to help us serve you guys better. And then finally, the biggest thing about 2019 is that it's our 75th anniversary. SB Service was founded in January of 1944, and so January of 2019 marks 75 years of existence and operations for SB Service. It's something that we're very proud of. You can, if you're on our email newsletter, you can expect to see more information about that. We're going to be planning some member events that are going to take place in 2019 around that concept of 75 years of community service and 75 years of service to our members. And so we're very excited about that. And those are just a few samples of some of the things that we're working on as a team at SB Service. And then the next thing I want to talk to you about is I would say in about the next month, you're probably going to get a letter from the Social Security Administration. And that letter from the Social Security Administration is going to tell you what your Medicare premiums are for the 2020 or 2019 year. They're going to be based on your 2017 tax return. And some of you who were part of the meetings around our financial reporting change that we had a couple of years ago, we learned a lot from that process. And one of the things that we learned is how we can help our retirees work better within this process. And so we worked with Salud Carvajal's office, and we worked with the Social Security Administration, and we've been helping retirees file appeals to the Social Security Administration to have their Medicare premiums reduced. And we've been very successful. I think we've gotten several people refunds. We've gotten one couple a refund of over $7,000 on their Medicare premiums. And what we learned through that process is that it's not just things related to our tax reporting change that can affect this. The couple that got a $7,000 refund actually sold a house and had an artificial increase in their income from selling a house, but they were able to get a refund of their Medicare premiums going through that appeal process. Now, we can't act as your advocate. We can't go to the Social Security Administration and lobby specifically for you, but what we can do is help make the forms available, answer your questions about how to fill out the form and when it might be appropriate to fill out the form, and then you can send that into the Social Security Administration, and we've had really good success with that. If you look at the back of your open enrollment materials, there's a page back there that explains that process to you, explains how you can contact us and learn more about that process. Erica, sitting right here, has been working with a lot of retirees out of our Santa Barbara office to help them do this, and we really hope that you will look into that and consider it, but also consider it for future use, because if you have an increase in your Medicare premiums going forward, there may be some things related, nothing related to your membership at SB Service, but there may be some things that you can do to reduce your Medicare premiums, and we just wanted to make sure that you were aware of that. And so finally, I wanted to close with a little bit of a pitch. You want to hear more about what's going on at SB Service and some of the things that we're working on? We would absolutely love it if you signed up for a monthly email newsletter. You can do that just by contacting one of your benefit reps outside, or you can go to our website at www.sbservice.org. Our website's also something that we're working on improving. If you sign up for the monthly newsletter, you'll get monthly updates on what your COLA is projecting to be for the next year. You'll get access to Board of Retirement meeting materials, and we do a lot of other things depending on what time of year it is. We send out surveys, we collect information, we tell you what the results of those surveys. We ask things about how many volunteer hours our members are contributing to the community, things about how many of our members are still working. It's a surprising number, about 30%. And then also next year, we're going to be sending out an annual report that's actually going to be a printed paper annual report. And it's going to tell you a lot about the investment returns of the system, the things that we're working on, some of the things that we talked about today, and give you a lot of information. It's also going to have information that's tailored to our active members who are soon to be part of this group as well. So with that, I just want to say thank you. Thank you again for coming. You're a very important part of our community. We really appreciate you coming down to see us today and learning about your health insurance benefits. And I'm going to turn it back over to Rebecca. Thank you.
Greg, thank you for being here, because as a current member and as a future retiree, it is very comforting to me to hear about the health of this system. Future. 10, 15, we'll see how many years. Before we get started on our presentations, there is one specific benefit that you all have that I want to remind you of, and it's an important one to remember as you're here today thinking about your insurance options, and it's Care Counsel. So Care Counsel, you are all enrolled. Care Counsel is our healthcare advocacy group, and they are a subsidiary of Stanford Healthcare. So as such, they know our plans inside and out. They know the unique nature of our retirement plans and the Medicare issues. Integration with Medicare is a really big concern that they are experts at. But Care Counsel is there for you if you are here today thinking, do I want to stick with the EPO or go to the high deductible health plan? Is United Healthcare a good fit for me? Do I want PPO or HMO? I need a second opinion, and I'm really not sure how to go about getting one. I've got this unusual diagnosis that I really know nothing about, and I just don't want to go on Google and scare myself. So you can contact Care Counsel. They advocate for our members in your interactions with your insurance. They also help you in obtaining necessary authorizations or second opinions. But they're really there to help you choose the best path for you in your healthcare experience. They can help navigate Medicare, either enrollment or billing issues with you, any grievances or appeals that you may have. And again, they've got this amazing access to the Stanford Health Library that literally has hundreds of videos and workshops that you can avail yourself of. So Care Counsel is a phone call away. They're up in the Bay Area, but they're available 6:30 in the morning until 5 p.m. every day. Their phone number and information about them, including their website, which has some really great new Medicare tutorials and videos that they've just loaded, are listed on about the 4th page of your booklet. So if you're here today and you've got questions that really aren't specific to the plan, but really about pros and cons, or if you've got a grievance or an issue that you need assistance with, our healthcare advocacy group, Care Counsel, can walk alongside with you. So to that end, I'm going to now pass it over to our first presentation. And today to talk about Carum Health, which is a benefit you may not be aware of, is Kim Hawk.
Good afternoon. So Carum Health is a program. Let me start out by saying this is an added-on program that is a surgical program free of charge to patients and their dependents. What is important to note is that it is only available, however, for early retirees. That means retirees that are 65, that are under 65 and on one of the Blue Shield plans. So if you are an early retiree, if you're on one of the Blue Shield plans, you have access to this Carum Health surgical benefit. So really, the whole idea of this program is to simplify those times when you need surgery. So I know in my experience that as we get older, we need more and more things. More and more things tend to kind of fall apart, if you will. So at the time when the doctor has said, I think surgery is necessary, whether that's a shoulder surgery, knee surgery, hip replacement, those types of things, that's when you want to call Carum Health. They will help kind of move through the path that's so confusing, working with insurance, working with the hospital that you're going to go to, the surgeon that you're going to elect, and all of the paperwork that's involved. Carum Health has a smooth process of a concierge who will walk you through the entire process from start to finish. Once you finish the end surgery process, they will also help get you back into the local area of care if you need follow-up care or physical therapy and that type of information. Oops, where am I aiming? There we go. So the Carum surgery path is simple. If you need surgery, you call Carum Health, you talk to that concierge, and they will walk you through the rest of the process. They will help you collect information. They will help you elect the hospital that you're going to go to, and they will help you elect the surgeon that you're going to use. The different part of Carum for surgery is that it's considered a travel benefit. So Carum Health has centers of excellence that are not in the local area. These are areas like Stanford Health in San Francisco, Scripps Hospital in San Diego. They have some new providers this year, St. Joe's Hospital and also Hoag. So those are centers of excellence that Carum can help get you to, along with you and a companion, and Carum Health, the plan. So your benefit will provide all the travel cost at no cost to you for yourself and also a companion. So the difference in this program, again, is the cost. And it sounds too good to be true. It's true. So if you were to kind of look at this in comparison to someone who's on the EPO low plan today, if they needed surgery and they're going through the standard plan, the Blue Shield plan, which you can do, they're going to pay a $300 deductible. There's a copayment for surgery of $500. There's a coinsurance for the surgery in the facility, and probably they're going to hit their total out-of-pocket maximum of $2,000. Under the Carum Health program, they're not going to pay any of those costs. So no deductible, no copayment, no coinsurance, and you will actually get a travel benefit that will get you to and from the hospital that you choose for surgery. So the procedures that Carum Health are covering are the musculoskeletal and orthopedic, so the knees, hips, and that type of thing, spine, shoulders and elbows, wrist and hands, ankles and feet. They've now introduced coronary bypass surgery and also bariatric surgery. But another thing important to note, that if you're on a Blue Shield plan and you're having surgery of any kind that is a planned surgery, you want to give Carum Health a call, because if it's not a surgery that they're covering today, they take that information and they see if they can maybe make that something that they can provide further down the road. If they're getting a lot of people who are needing a specific surgery, they're putting those contracts in place so that they can handle that in the future. But for now, lots of those covered procedures. And again, it's covered under all of the Blue Shield plans as long as you are an early retiree. Also, any dependents that are on your plan that are not Medicare eligible. If you're on COBRA and you're not Medicare eligible, you would also be eligible for this plan. So what we've heard from people going through this program for surgeries is nothing but good news. We've on Carum's website, there's some testimonials of county employees and county retirees that have actually been through the Carum program for surgery that you might want to check out. And registering is easy. You don't need to enroll in a plan. This is available to you on a voluntary basis. You just need to contact Carum. Carum's information is also in your booklet that was mailed to you for open enrollment. And again, the whole process of the Carum journey from start to finish, you're handheld by a concierge. They really walk you through the entire process, collecting records, getting you to where you need to be, and help getting you home safely and back into recovery. And it's they just handle the whole process for you at zero cost.
Thank you, Kim. Today we also have Claire Gilmore from RX and Go. If you were here last year, you heard about this. We're really excited that this is the second year that this voluntary prescription drug program is in place. So, Claire?
Thank you. Thank you, everyone, for having me here. So my name is Claire. I'm here from RX and Go. So we're going to talk a little bit about the program, how it works, and what to expect. The first thing to mention is this is also for early retirees on the Blue Shield program, but it is a voluntary mail order generic pharmacy program. So it's completely free to you if you are a Blue Shield early retiree. If you are on the PPO plan, we have a list of over 1,200 medications that are available to you. These cover things like diabetes, blood pressure, cholesterol, asthma, allergy. If you're on the high deductible plan, then there are 800 preventative medications that are also covered at no cost to you. Our pharmacy is based out of Southgate, Kentucky, which is right outside of Cincinnati, and it is mailed directly to your home. So it's a great way to save both time and money. So the first thing you want to do is just go online to our website, or you can call to see if your medication is covered. So you'll go online and you'll click View Products in the bottom category. And if you are on the high deductible plan, just make sure that it has a check mark for the preventative products. If you see your medication is available, the next thing you want to do is register with us, which you can do online. We also have printouts here if you want to fill it out and give it back to me, or you can call and give your information over the phone. Next, we're going to have your doctor submit your prescription, and then just sit back and relax because your prescription will arrive to your door. So again, you can register online, which the arrow is pointing to where you do that there. Again, you can call or fill out the form that I have here. And then your doctor will submit your prescription the same way that they should be doing it now for, if you're getting it from Walgreens or CVS, etc. They can electronically prescribe it to our pharmacy, which is called Specialty Medical Drugstore. And or they can phone, fax, or mail it in. It takes about 5 to 7 business days to arrive at your home, so make sure when you provide your first order that you still have a couple medications left. We don't want anyone going without their prescriptions. And then you can also set your medications to be automatically refilled at the end of the 90-day period. So if your doctor gives you a year worth of refills, at the end of the 90 days, it will automatically show up at your house. If you ever change your address, please just call our customer service to let them know, so we're sending everything to the right place. And again, this is kind of just a summary of everything I talked about, but it's a really great benefit that you have at the County of Santa Barbara. People love it. It's for maintenance medications and diabetic test strips and monitors. 90 days for almost all medications unless it's a controlled substance, and it's at no cost to you, so it's $0. We will never need a credit card or any payment information from you. Thank you so much.
Thank you, Claire. So your prescription drug plans, also specific to your Medicare prescription drug plans, are managed through Express Scripts, and Kim is going to discuss Express Scripts now.
Yes, so again, Express Script is the pharmacy program for those who are on the Blue Shield plans. So you'll be hearing shortly from the medical plans. So when you hear from Blue Shield, just know that Express Scripts is the prescription part of the Blue Shield plans. Oops. So just want to remind you, if you are not aware, that there are 3 types of benefits available to you through Express Scripts. There's the retail pharmacy, the walk-in pharmacy that you can go in. You can get a 30-day supply of medication. You can go to the mail order pharmacy for 90-day supply of medication. Typically that is 3 months supply for the copay of $2. So that gives you a little bit of benefit there. There's also the specialty pharmacy. That's for medications that may need kind of additional care. Goes through that specialty pharmacy. Every year the formulary changes. So how many know what a prescription formulary is? If you've been in these meetings, yeah, nice. A lot of you said yes. So if you've been in these meetings in the past, we talk a lot about the formulary. The formulary list is just a list of drugs that any prescription drug plan is offering under their plan. It will typically be all classes of medications, meaning that there's not a condition that you can have that there's not a medication available. So what the formulary is, though, is it is the choice of the pharmacy to choose those medications or those brands especially that are cost effective. So in that case, there might be 2 particular blood pressure medications from 2 different manufacturers. They both do the same thing. one of them might be cheaper and be on a particular formulary. So the formulary does change every year, sometimes twice a year. So just know that there is formulary available on SBCSER's website. There's a little bit of a look at it in the booklet and on the screen above, although it's really hard to see that. So remember that as a member of the Blue Shield plans and Express Scripts, that you do get preventive vaccines. So this includes things like the flu shot, tetanus shot, hepatitis shot, meningitis, and pneumonia. Those you can go into a walk-in pharmacy like CVS, any pharmacy that will accept your Express Scripts or is contracted through Express Scripts, and you can get your those vaccines there in that shop. For Medicare participants, you also have a special Medicare list of vaccines that you can also get through the program. So there's just some coverage management that you're probably aware of if you're taking any prescription drugs through your current programs. And really it's, there are three that are common among all prescription plans. The first is prior authorization, second is step therapy, and the third is drug quantity management. So, oops, let me just go back. Prior authorization, that is just a way for the right patient to get the right medication. So an example of this would be there's a medication that is specific to breast cancer. If that is being prescribed by someone, the prior authorization is just making sure that, yes, the diagnosis of this person is breast cancer and not brain cancer or some other form of cancer that this drug would not be effective for. So it's kind of trying to catch that at the point of service and being sure that the right medication is given to the right patient. Step therapy is just making sure that you can follow a path that kind of helps, kind of what I said about cost. So specifically that is when there is a generic available or there's a brand name drug that is a cheaper cost, step therapy just says try the cheaper one first. If for any reason that does not work for you, talk to the doctor. The doctor can do a prior authorization to get the drug that does work for you. Because sometimes there is the case where a medicine doesn't work and the doctor has to go through a process to get you the right drug that works. But for most people, that step therapy process gives them the right drug that's affordable to help keep the plan costs down and your costs down. So that is a step in that direction. The drug quantity is just a management tool to be sure that nobody is getting more medication than is required by the manufacturer and by the FDA. So a sleep aid is a popular one that a lot of doctors will overprescribe for, and it's not necessarily safe. So the drug quantity management just helps make sure that you're getting the proper safe medication. So the plans have not changed. For the EPO low, the retail copayment is $15 for generic, $35 for formulary, and $50 for non-formulary. Remember, those formulary brands are the ones that Express Script put on their list for a preferred cost. And then specialty through that Accredo pharmacy. For mail order, it's typically double. You can see 30, 70, and 100 for those, but for a 90-day supply. For the EPO high option, which also includes those court retirees, retail 30-day supply for generic is $10, $35 for formulary, $50 for non-formulary, and again, pretty much just double at mail. For the PPO plan, $10 generic, $35 for formulary, and $50 for non-formulary, and mail order again the same. For the Medicare plan, so there may be those of you, now we can talk about benefits for those who are on Medicare. For those who are on Medicare and you're on the Blue Shield plans, you have the ability to elect a Medicare prescription drug program. Now the difference is that this particular program is a Medicare Part D program, and because it's working directly with Medicare, the cost to you to have the Medicare PDP is lower than if you were on the standard prescription plan. So if you are Medicare eligible on the Blue Shield plans, this is a plan that you want to take a look at, the Medicare prescription. One of the benefits, because it is a Part D plan, is that you can get your 90-day supply at a walk-in pharmacy. Medicare says do it however you want. If you want to walk in and get 90-day supply, or if you want to mail it in and get 90-day supply, that's up to you. So for the generic, for a 30-day supply, $5, $20 for formulary, $50 for non-formulary, and then depending on the day supply would depend on that copay. All right, so just some tools. Remember that you will have a separate pharmacy card with your plan. So if you are switching plans this year at all, remember that you will get a medical card and a prescription card. That there are lots of information for you on expressscripts.com. You can register and you can see your own specific drug information. You can look at those things that might help you save money. If you're taking a certain medication, it will tell you what medications that might cost you less that maybe you want to talk to your doctor about. Lots of good information on the website. And then MyRx Choices gives you, again, lots of information specific to you, side-by-side drug comparisons, that saving and helpful drug information, and access to also some consumer reports. So there's lots of information available online. And there's also a mobile app. So if any of you are like my 82-year-old mother who texts me almost every day, she's got that smartphone down, and maybe you do too. There's a mobile app for you on for Express Scripts to see your prescriptions in that way as well. Lots of good information. All the information for contact is in your booklet that was mailed out in the back under the contacts.
Thank you, Kim. So we started to talk about Medicare a little bit. Is there anybody here who has not yet signed up for Medicare? All right, this is for you. We're going to talk about Medicare a little bit. It's always a good refresher for those of us who have it as well. So I want to talk a little bit about Medicare and Santa Barbara County Employees Retirement System Insurance and kind of the ABCs of Medicare. So Medicare, there are many different letters associated with the different versions of Medicare that you can receive and the different services they offer. Medicare Part A is the hospital insurance. Medicare Part B is the medical insurance. And when you have A and B together, that is considered original Medicare. And original Medicare is administered by CMS, which is the Center for Medicaid Services. So Medicare Part C is also known as the Advantage Plan. Medicare Part D is your PDP. You'll hear Kim talk about it, me talk about it. That means Prescription Drug Plan. And then there's a myriad of other forms of Medicare. There's F, G, K, L, M, and these different Medicare supplemental plans. All of these supplemental plans are available to you through private or group insurers. So this umbrella of Medicare, Part C, it's Medicare A, so hospital, B, medical, D for drugs, and then there's some additional benefits that you'll oftentimes be able to avail yourself of. So when are you eligible for Medicare? Unless you are disabled and already receiving disability, you are eligible for Medicare when you turn 65, okay? If you're already receiving Social Security benefits, you will get a packet sent to you in the 3 months prior to your 65th birth month. They automatically send this packet to you, and it includes your Medicare card, and that Medicare card is for Parts A, hospital, and B, medical. If you are not receiving Social Security benefits in that last couple of months right before your 65th birth month, you will need to outreach on your own to get yourself signed up. You can either call to the Social Security Administration office, you can go down there, or you can go online and log in to their website at medicare.gov and get yourself signed up in that period of time just before your 65th birthday. So Medicare enrollment, people ask, do I have to sign up for Medicare? It is voluntary, but it comes with a big detrimental impact if you don't. When you are eligible at age 65, it's kind of a three-part detrimental effect. If you don't enroll in Medicare when you're eligible, and you decide to enroll later, you're going to pay a penalty in the form of a higher premium for the rest of your life. Also, you don't get to sign up until their open enrollment season, which is in October and November. Also, you will be out of Medicare eligibility. You won't be able to get Medicare until that time, and you'll very likely have to pay a higher premium for insurance as a non-Medicare insured until their open enrollment hits. So when people ask, should I sign up for Medicare or not, I say I would highly encourage you to do so, and if you don't, please know, higher premiums for the rest of your life when you do sign up. You can't sign up until their open enrollment period, and until that time, you are stuck with a plan that may be quite costly to you. So you can sign up at medicare.gov. The website is here. They've got their phone number as well. It's very easy, 800 Medicare. So you're highly encouraged to sign up. So what does it cost? Medicare Part A usually has no premium or a fairly small premium. Part B, everybody pays a premium regardless of what other insurance you may have. If you enroll in Part A and B, it's going to affect your employee-sponsored insurance. And you'll typically be able to enroll, if you choose, in a prescription drug plan, which is that Part D. And you'll generally be able to continue your employee-sponsored insurance. Okay? If you enroll in Medicare, you can use it as your sole insurance if you want to. You can purchase an Advantage plan, which is the Part C, privately or through SB-CSRS. You can purchase a Medigap plan if you want to, or you can keep your employer-sponsored insurance to be secondary, not a supplement to, but secondary to your Medicare. So Medicare pays first, and then your insurance comes in and pays oftentimes much of the remaining portion of that bill. We hear very often from our retirees with Medicare plans that they pay nothing out of pocket between Medicare first paying and then their insurance plan paying the remainder. So again, the cost, Medicare Part A is usually a small premium. Part B, everyone pays a premium regardless of what insurance you keep. And if you are enrolled in employer-sponsored insurance, your costs would then be your Medicare Part B premium that you would pay through Social Security, and then your insurance deduction through SB-CSRS, your premium payment, which is a deduction to your monthly benefit check from SB-CSRS. So if you remain enrolled in employer-sponsored insurance, it's important to know, so for those folks who are going from a non-Medicare plan to a Medicare plan, you still get your subsidy. So that $15 subsidy that you receive for each of your years of service as an offset to your monthly premiums continues. If you decide that you're going to get a plan elsewhere and you're going to drop your medical insurance with SB-CSRS because you found something better through AARP or AAA or Costco, that's great, but you will no longer get that subsidy in the amount of $15 because there is no insurance deduction to offset, okay? But you will receive a replacement benefit. It's called a health reimbursement arrangement. We'll talk about that next. So what do you need to do when it's time to enroll in Medicare? Do your homework just to see what the plans are and if they're a fit for you. Contact Medicare by calling them at 800 Medicare or visiting their website at medicare.gov, and contact us. Contact SB-CSRS 90 days prior to your 65th birthday, because there will be changes that will need to be made on your plan if you have one, regardless of what your decisions are. And what's not on this slide, but I would reiterate it to you, contact Care Council. I was really impressed when they put up some new videos about Medicare enrollment and Medicare plan management on their Care Council website. So I did also mention the health care subsidy, the health reimbursement arrangement. I want to talk for a few minutes about the health care subsidy because sometimes there's some confusion about it. For those of you who are insured through SB-CSRS, retired members of SB-CSRS who participate in county-sponsored health insurance plans currently receive that health insurance subsidy that's $15 for each year of service per month applied towards your premium costs. So I put a little example up here that kind of shows how that works. If you had 20 years of service with the county, or other plan sponsor, if you multiplied that by $15, that's $300 that is going to go towards your monthly county health insurance premiums. So if you had a health insurance premium, you're looking at the rates in the book today and you see a rate of $1,500. Know that your health insurance subsidy of $300 is going to reduce your monthly premium that is deducted from your monthly benefit check from SBCSERS to $1,200, okay? Important things to remember: surviving spouses and beneficiaries who receive a benefit from you when you pass away, a continuance benefit, they are also going to receive an amount proportionate to that continuance, that benefit continuance percentage. So let's say when you're retired, you elected the unmodified benefit, you're getting the highest calculated benefit to you, and when you pass away, you'll be leaving a 60% continuance to your qualified continuance beneficiary. They would get 60% of your subsidy as well, okay? And members who receive a disability retirement allowance are currently receiving a health subsidy of $187 per month. And if you and your spouse are both county retirees, you can pool your subsidies. So if you've got a $300 subsidy and your spouse is also a county retiree and they've got a $300 subsidy, you can elect insurance, choose them to be your dependent. Their $300 subsidy is going to come over to your account, and collectively you will see $600 come off of your premium on a monthly basis. So that's called pooling, okay? So you can pool your subsidies between county employees. Now, what if you don't take county insurance? Let's say instead you decide that you're going to go out and purchase insurance through AARP or some other company, or you're actively employed in your retirement somewhere where they're giving you health insurance. You don't have a health insurance deduction from SBCSERS, so there's nothing to offset. Well, since you're not getting that $15, there actually is a replacement benefit to that, and it's a health reimbursement arrangement. Instead of getting $15 for each year of service towards monthly premiums, you would get $4 for each year of service on a monthly basis, and that is deposited into an account that is administered by a company called WageWorks. They're a third-party administrator, and Greg mentioned them earlier. They provide a debit card so that you can, at point of sale for glasses, co-pays, premiums, prescription drugs, any qualified medical expenditure that's listed on their website, you can pay for it with that money, okay? So you can also set it up that they will pay you back for your Medicare Part D premiums. That's an easy one to do on a yearly basis. You let them know what Medicare sent you as a letter as your Part D premium cost, and they will pay you back for it each month as you receive that subsidy amount. Important things to know about this: when you disenroll from a health insurance program with SBCSERS, we automatically enroll you in this. I see this happen from time to time where people will leave because they don't need the insurance anymore, and they start to get this HRA money sent to their HRA account, and they forget that it's there. Don't forget it's there. It's your money. So if you cancel your insurance, you leave SBCSERS insurance, and you go out on your own, this money will be there for you, okay? And also, it is a benefit that, just like your continuance of your subsidy in your passing continues in a proportionate share to your beneficiary, it would also continue to your beneficiary. So how do you, if you are sitting here thinking, I have an HRA account, I have money in it, I haven't spent it, what do you do? So what you would do is you would call us, and we would put you in touch with WageWorks. I've put information about WageWorks within the open enrollment booklet. You can call them. They will not allow me to request a new debit card for you. They need to speak with the member directly. They can issue you a new debit card so that you can use that money. So we wanted you to be aware of it. If you have any questions, please give us a call or contact WageWorks. They are also listed in the back of your open enrollment book under the important contact names. So now let's start to hear about our actual insurance plans, our health plans. And the very first one that we're going to talk about is Blue Shield. And Mary Hazel is here from Blue Shield today.
Hi, Mary from Blue Shield. And the one thing I like to tell everybody right up front about your health plan is that if you like the plan you're in, There are no changes to the benefits in your plan this year. So if you're in the EPO low option, you like it, you don't have to do anything. You can remain in that plan and know that your copays are going to be the same as they've been in the past years. So we continue to offer the low option plan, the high option plan, the Blue Shield PPO with the in and out of network benefit, as well as the high deductible health plan. The nice thing about all of these plans is if you travel, whether you're in California or you're going nationwide, all of these plans can go with you from state to state. So if you're visiting your sister in Arizona, you can use the Blue Cross Blue Shield of Arizona providers. If you go to New York or Florida, they also have a worldwide network. So if you're traveling overseas, you might want to check out the website and see, you know, what hospital is going to be in Florence that might be there should you need to get services while you're outside of the country. And again, you're going to use any Blue Cross Blue Shield provider outside of California. In California, it's Blue Shield of California providers. One of the things we really like to promote are some of our digital and mobile care connections. Our Nurse Help 24/7, BlueShieldCA.com, which is our website. We've got Life Referrals 24/7, where you can call and talk to a counselor. Teledoc, which is my new favorite thing. It's kind of like urgent care over the phone. We have a telebehavioral health as well as Wevolution. So our access to care actually puts you in control to manage your health where you need it, when you need it, and how you'd like to receive those services. With BlueShieldCA.com, we do have a mobile app, and it's really neat because whatever plan you're in, for example, let's say you're looking for you went to the San Diego Zoo and you're looking for an urgent care center down there. You can pull that up on your mobile app and it will only bring up urgent care centers that are in your plan as long as you've registered for it. And it's kind of like Starbucks. It tells you like how far they are away from you and gives you the directions to go in there. So if you don't already have the mobile app and you have a smartphone, you might want to try that. Nurse Help is where you can call and just talk to a nurse 24 hours a day about any condition you might have. It's just talking to a nurse. If you need something a little more than that Nurse Help, Teledoc is a relatively new program that we have where you can call and talk to a physician 24 hours a day. It's kind of like urgent care, but over the phone. And there's also an app for that. Has anybody tried Teledoc at all? It is so nice. I hope you liked it. He's given me the thumbs up. Oh my gosh. Have you ever gone to urgent care and got in right away? No. You sit there, you're next to a 3-year-old who's hacking up a lung, and you're just like, please don't breathe on me. Please don't breathe on me. Call Teledoc. They'll give you a callback window. Right now it's running about 8 minutes that they can call you back, or you can set up an appointment. And it's just like urgent care, but you're not seeing the doctor. However, if you have something where they do need to look at you, there's a Skype feature, or you can upload a picture. So maybe you have a rash, you can take a picture with your smartphone and upload it. And they can go, ooh, yeah, you've got, poison oak, and let me prescribe the cream for you. So if you have a condition that needs a prescription, once they've determined it, about 80% of the calls do result in a prescription. They can electronically send that to the pharmacy of your choice. And we talked earlier about traveling. So you're in Montana and you're fishing, Teledoc, because there's not an urgent care out there on the Snake River, wherever you happen to be, right? Call Teledoc. They can send it to the nearest pharmacy, even though it's not your regular pharmacy, and you can get that condition taken care of. It's great for like sinus infections or urinary tract infections, kind of simple things, pink eye, anything like that. So I really urge you to check it out. The number will be on your ID card as well. It's 1-800-TEL-A-DOC. It's my little pitch for Teledoc today. Some other on-the-go wellness tools for you at Wevolution. We've got a step tracker called Walkadoo. We have Daily Challenge that can give you just simple activities to do every day. You can pick a path. Maybe you want to concentrate on de-stressing. Maybe you want to increase your strength. they'll send you either a text or an email every day about a simple challenge to do, and then our Quit Net Smoking program. And you can talk to a counselor there. BlueShieldCA.com is your gateway to all things Blue Shield, and you can look at your claims. You can check where what doctors are in your network. There's even some pricing tools out there. If you're having there's a number of common procedures, and it'll help you compare the costs of having it done, at Hospital A or Hospital B. So it's really a great thing. If you haven't gone on and registered, it's just like shopping at Amazon. Give yourself a username and password, and you're good to go. If you ever lose your password, you can call our customer service, and they have a way to spoof your account. And, like sometimes I even forget my username if I use too many usernames, but they can help you reset that and get you going again. So if you tried it one time and you forgot it and you're like, oh, I forgot it, I don't know what to do, call customer service, the number on your ID card, and they'll help you out. All righty. I'm going to pass it on down the road. If you have any questions afterwards, come on up and see me, okay?
Thank you, Mary. And Teladoc is an amazing service. It's just a really wonderful feature. Today, we have from United Healthcare, Stephen Richmond, to talk to us about the United Healthcare plans. Thanks, Stephen.
Got it. All right, folks. We are happy to offer you guys a true Medicare Advantage plan, one that doesn't require coordinating of prescriptions and claim forms, and in fact, no deductibles either. And I won't repeat too much of what Rebecca mentioned earlier about it, but we do want to talk about basics and how they pertain to the plan benefits within a true Medicare Advantage plan. We're here to help you live a healthier life. We're going to give you some resources and some tools and make you feel connected and able to have the best plan that's suitable for you. Now, we already talked about original Medicare Basics, the A and the B, and who's eligible. And we know that A and B is part of it, and then you get your card for that. Also, as was mentioned, Part C is when we have a Medicare Advantage plan, and what that does for you is that encompasses all of the A, the B, the prescription plans. It combines that and several other wonderful features that you deserve after a hard many years of work. So let's get into some of the plan benefits and features. First of all, again, this is a single plan, and it's going to go through a private insurer, particularly in this case, United Healthcare. You're going to have, of course, all the benefits of A, the hospital, the nursing, the home health. You're going to have all your doctor's visits, outpatient care, and some other special doctor visit type information we'll get into, all your prescriptions, and of course, many additional goodies that will be attached to this. And so the overview is going to give us idea of the doctors, the prescriptions, and how to use the network for us. Again, first of all, we have a very large network, and your doctor may already be a part of the network. If you want to know, there's a website, uhcretiree.com. We had questions earlier about will my doctor be on that? And of course, there's lots of resources. You can call us or speak to the specialists that are here today to help you determine if there are doctors here for you that are in the plan. Okay, like we said, there's no deductible. And your annual out-of-pocket maximum, no matter what, is $6,700. Not too different than a lot of the numbers that we see thrown around. And we want you to also know that we have a couple of options for you. And I'm sorry we ran out of brochures, but I'm assured that there's many of them at the office, and you're going to need to come in anyway. So hopefully, if nothing else, this will pique your interest in knowing more. If you pick the high option, whether you go to your primary care provider or urgent care or a specialist, you're only going to pay a $5 copay. If you go inpatient or outpatient surgery, there's nothing paid in addition to that. Hey, the low option, you're going to pay $15 for the primary, $25 for the specialist, $15 for urgent care. Now, if you go in the hospital, your copay is going to be $500 under the low option. Outpatient surgery is going to have a $250 copay. Annual physicals, and this is pretty much across the board, as you folks know. We're not going to charge for an annual physical or an annual wellness visit. Hey, what's that? Well, we'll get into that in a minute because it's quite separate, and it's an additional benefit. Immunizations, screenings are all covered with zero copay. And then there are some specialty treatments like podiatry and chiropractic care. Under the high option, you're paying a $5 copay. In the emergency room, you are paying $50. They're also covered under the low option, but your copay ends up being a little bit higher. Chiropractic, we're only going to pay for half of it. Vision services, $25, Medicare covered. Hearing services, and just like the high option, you're going to pay $50 if you go into the emergency room. Again, there's more than 68,000 national, regional, local chains and independent pharmacies that will cover you for thousands of covered brand name prescription drugs, bonus drug in addition to Medicare drug coverage. So again, uhcretiree.com, please check on that for the list of the formularies that are provided. Now, something often scary, the way the Medicare rules were written is, they're really great on the first 3,820, and if it all hits the fan, they're really good after 5,000. So there is what a lot of folks call the payment gap or benefit gap. And this plan with United Healthcare has that all managed so that no matter how Medicare plans are written, you absolutely don't have to worry about it. You're going to be included, and you will never have a deductible at any point of the game. So when you read that, fear not. United Healthcare is going to cover that. And then we're looking at the difference between 30-day supplies and 90-day supplies, and of course, everybody, folks, I hope you're using mail order where possible. I mean, unless you just like to get out of the house and meet new people. But I really hope you do. It will save you money, save you time. And as you can see, it does save quite a bit of money compared to just going in every month. Your copays can range from generic to $7 to the unique and very high cost brand drugs every 30 days or 14. Every 90 days or 28. Okay, and that's under the high option. Now under the low option, your 30-day copays are going to be a bit higher, from generic to 10, 25, 40, and up to 40 for specialty. And then the 90 days go up quite a bit more, $20 a month for a preferred generic and up to $80 for the specialty. So all little things to take into consideration. We talked about a wellness visit versus preventive care. Something unique to United Healthcare is that we offer a preventive care visit in your home by a very highly trained, licensed healthcare professional. This won't be your doctor. It may be another doctor or a nurse practitioner. And they will help you review your health history, your medications, talk about any of your concerns, and they'll give you a summary. And you may even be eligible for a reward when you complete a house calls visit. Something also unique is that we offer a publication that will be mailed to you monthly, as well as available on the internet. And each will have its own strengths. The internet will have some soothing streaming music for you and some games, and the paper magazine will keep you busy with relevant articles, health news, brain games, and whatnot. And also there it is again, rewards. Okay, So now we talk about your annual wellness visit. Schedule that, and they are covered at zero copay. And if you'd like to make the most of your care, you just save time by combining both the wellness and physical into one visit. And do it early in the year to get any preventive care that you may need. Don't wait till the end of flu season. I tried that last year. It didn't work out so well for me. But make sure you follow through with recommendations. And again, you can do it any time during the calendar year, no matter when your last one was. Hey, Silver Sneakers, this is for everybody here. And this allows you to go to all kinds of different gymnasiums or health places to exercise. You know, what they offer you that they don't offer a lot of folks is the trained instructors, exercise equipment at over 14,000 participating locations, group fitness outside of traditional gyms. And some of you guys can't get out of the house for whatever reason. Maybe you live too far, maybe you're injured. Well, we have these at-home kits that are going to be available. Okay, how we doing? All right. So virtual visits. Hey, you know, you got these phones nowadays that you can talk to your grandchildren and see what they look like. Why not use that to talk to the doctor? Why go get in your car and drive to him just because you have pink eye or your tonsils are inflamed? So something that we've made that will help be convenient for you is called virtual doctor visits, and you'll be able to do a video chat with a doctor on your computer, tablet, smartphone, day or night. You can ask questions, get a diagnosis, and if so necessary, he'll even prescribe medication. How much time will that save you? Think about that. And they're good for, again, minor health concerns. You don't want to probably show them a broken arm or a compound fracture or any lacerations. You know, you probably want to get that taken care of elsewhere. And you'll find a list of the participating virtual doctor visit providers just by logging in to the member website. Also briefly, behavioral health visits. They're there to give you evaluations for depression, trauma, loss, strength, stress, or anxiety. And of course, the nurse line. Sometimes we just need to talk to somebody, and that's what the nurse line is for. Now, you may know some caregivers in your family who are taking care of people with really chronic, possibly, you know, the rest of their life type illnesses. And that's a special situation right there. And we are offering solutions for caregivers, and you'll have more information on that available. There's actually some flyers outside on that. And they're going to give you some advice, and we'll have an RN perform an in-person assessment of your particular situation. You'll receive personalized care plan with recommendations. So that's just a review on understanding original Medicare rules and the legalese. But what we want you to do is relax and know that at UHC there is a Medicare Advantage plan that will combine all these things together for you. Once you get your card, go register online. Find the doctors in your area. It'll automatically know what zip code you live in and keep it close by. View your plan documents, review drug lists, sign up to go paperless, or even print a temporary ID card. Raise your hand if you've ever misplaced your ID card. Nobody? Oh, you guys. Okay. Learn about health and wellness topics. Sign up for Healthy Challenges. Thank you. That's what we offer, and we hope that this is productive in helping making your decision.
Steve, thank you very much. And as a reminder, it's a lot of information that you're seeing today. Do know that since we are recording these sessions, these are all going to be chaptered and on our website. So you can go through and hear the presentations again, or in Steve's instance, watch the PowerPoint presentation. So next up, for those of you who live in the Kaiser areas, and Ventura is one of those, we have Marisol Garrido from Kaiser to talk about Kaiser benefits.
Thank you. I think I am. Yeah. Hello, everyone. Good afternoon. My name is Marisol Garrido. It's a pleasure to be here. I'm going to give you a very high overview of Kaiser and who we are, and then talk about some of the plans that are being offered to you. Again, just a reminder to reiterate again that Kaiser is the plan that is available to members that live in our service areas, and closest to here would be Western Ventura or Ventura County. Our Medicare health plans for 2018 received Medicare's highest possible rating, 5 out of 5 stars. And in California, we received 5 ratings. So Medicare rates health plans and drug prescription plans on quality and performance. So I'm happy to say that most of our regions received this 5-star. Just to give you an example of some of the areas Medicare reviews for these ratings, they include the plan's services and care, how our doctors detect illnesses and keep members healthy, and also how our plans help our members use our recommended prescriptions. So who we are, you probably, I'm sure most of you have heard about Kaiser Permanente and who we are, but we're one of the largest nonprofit organizations here in California. We were founded in 1945. We're in 8 states plus the District of Columbia. We have here in California our members have more than 200, access to 200 providers that they can go to. And we have 12.2 million members nationwide. More specific to Western Ventura, in Western Ventura, we have 3 medical offices where we have specialty care services, primary care services, behavioral health, and we also have 2 offices in Oxnard and another one in Camarillo. The way we work in the Ventura area is we contract with a planned hospital called Community Memorial of San Buenaventura. We don't have our own hospital, so we do contract with the local hospital in Ventura. So how our members access that hospital would be by, getting referred by their primary care doctor or specialist to use that hospital. Our pharmacies are also in our medical offices for Kaiser Permanente, but in Ventura, we do have a special contract with independent pharmacies in the area, and I'll talk a little bit more about that. So what you get with Kaiser Permanente, we're an integrated delivery model, how we provide care to you. It's a one-stop shop, so if you go to one of our medical offices, you know that you're going to have your primary care doctor there. You're going to have x-ray. You're going to have pharmacy. You're going to have lab. Some of our medical offices, as I mentioned, offer specialty care services in the Oxnard and Ventura area. So it's that one-stop shop where our doctors are all connected, as well as the pharmacy. It's a hassle-free healthcare plan with pretty much no paperwork, unless, you forgot to pay a copayment and then we send you a bill. But pretty much you come in, you pay a copayment, and we take care of everything for you. Kaiser Permanente is composed of 3 entities. So I'm part of the health plan. We have the doctors, and we have also the hospital. So it's all integrated, where we don't really, very seldom do we contract with providers here in California. So you could get many services under one roof. And one thing I want to mention is, as I mentioned, everything's connected when you're a member of Kaiser. Also, you're connected with that electronic health record. So that health record goes with you wherever you travel and you visit a Kaiser Permanente facility. One thing that we highly recommend is that when you become a member of Kaiser, you select a primary care doctor. We encourage everyone to have their own primary care doctor. You select the facility and you select your doctor. You can look up our doctors on kp.org/search doctors, and you can see their biography you can look up by location or specialty, and you could see their biography. There's a lot of information about our doctors online. You can change doctors anytime. If you're a new member or an existing member and you're not happy with your primary care doctor, know that you can change doctors anytime. You're never locked into with that doctor. So if you didn't like your doctor today and you want to change the doctor tomorrow, you can do that. And we make that effective the day that you call to make that change. One thing that I want to say about doctors here in regards to referrals, referrals are very easy with Kaiser. If you need to be referred to a specialist by your doctor, it's very simple. There's no paperwork that needs to be completed. There's nothing that is sent to you. Nothing that needs to be authorized. That's a conversation that you have between you and your primary care doctor, and then your primary care doctor refers you to the next level, which would be your specialist. And before you leave your doctor's office, we actually make an appointment for you with that specialty care department. Okay, so make it very easy for you. As a member, you can self-refer to OB/GYN, behavioral health, optometry, and the allergist. It's good to know when I can self-refer because I'm saving time, and I'm also saving a co-payment where I'm not going to ask for permission from my primary care doctor if I can see that specialist. So remember, 5 specialties that you can self-refer to without a referral. Your care, your way. We have many options that are available to our members in terms of how they want to access care at Kaiser Permanente. One of them is see your doctor in person. So you have, you're not feeling well, you can do a same day, next day appointment with your primary care doctor. You can also opt for a telephone consultation. Telephone consultations and video appointments are very convenient. We talk about convenience. We talk about having saving time, right? And then it's a free service that we offer to our members. So you can schedule a video or a telephone consultation with your doctor without having to schedule that face-to-face meeting. That doctor will call you and do a consult over the phone, or a video consult over a video over your phone or iPad or your computer, and there are free visits. Those are free visits. You also get a 24/7 nurse advice line that's available to you. We also have urgent care that's available, and I'm very happy to announce that in Ventura this week, our hours changed for urgent care, offering urgent care now daytime hours from 9 a.m. to 9 p.m. So what we've done with all our Kaiser facilities offering urgent care is we've standardized the times. And then lastly, you can email your doctor, which is a very convenient way to communicate for non-urgent questions. Care away from home. As a Kaiser Permanente member, you have access to worldwide coverage. Okay, so know that wherever you're traveling, whatever area you're in, you have emergency coverage. If you're outside of a Kaiser Permanente area, you're not in a state that Kaiser's in, or you're overseas, you are covered for emergencies and urgent care. This is our new travel line. So before, you would have to call customer service and get information about emergency. Now there's a dedicated travel line that you can call, and you can also call them if you need an earlier refill because you are going to be out of the area, and they can coordinate that for you. If you have an emergency and you paid out of pocket, now you need to file a claim. This is the number to call to get to file a claim so you can seek reimbursement. Our online and mobile capabilities, we really encourage and push every Kaiser member to make sure that they sign up for kp.org and register on our secure website by, logging in with a user and a password. And by doing that, you have access to care 24/7, communicate with your providers. So downloading the app on your fancy phone is an extension of kp.org. A lot of the features are available on this app where you can schedule appointments, cancel routine appointments, you can email your doctor, order prescriptions, you can view and pay bills, etc. So this is a good way to be a convenient way to use the services for Kaiser Permanente and communicate with your providers. Healthy resources. Kaiser has been a pioneer on preventative medicine. We want our members to stay healthy, and we've been, believing in preventative medicine, preventative care for many, many years, 75 years total. So we have a dedicated department at each of our Kaiser facilities called Center for Healthy Living that we offer, where we offer classes for our members. All the classes that our members attend are free. So, if you wanted to take a diabetes class, a weight management class, a cholesterol class, nutrition class. Those classes know that are available through the Kaiser Permanente facilities. We continue to offer or have a service called personal wellness coaching, where you speak with a healthcare professional over the phone, and you have many programs online as well. And you have also discounts for different services, for complementary services like chiropractic care, massage therapy. And so that information is available to you on kp.org under the Wellness tab. So we offer you a total of 4 plans. 2 plans are non-Medicare and the other 2 are Medicare plans. So just a very high overview, just highlights of the plans, just to keep in mind how the plan works. Your annual out-of-pocket, just know that anything that you pay Kaiser as a co-payment all counts towards that maximum out-of-pocket. Once you reach that maximum out-of-pocket, then Kaiser pays your plan at 100%, okay? Preventative care, this plan and the second plan are going to be covered at 100%. So urgent care is $15 on this plan, emergency is $50. So it's really important to familiarize yourself with urgent care. This is our $20 plan. So the annual out-of-pocket doesn't change, but then your office copayment does. So again, urgent care, office visit, specialty care, $20 per visit. Emergency care changes here to $100 per visit. This is your Medicare Senior Advantage plan. And just to highlight, the annual out-of-pocket maximum is $1,500 per calendar year. So it's just one out-of-pocket, whether you're by yourself. And you have, just again, a highlight. You have eyewear coverage on this plan, as well as hearing aids on this plan. And then you're covered for a 100-day supply of medication for 1 copayment, $10 for generic and $25 for brand. This is a $20 copayment, also has an allowance of for eyewear and hearing aids. So pretty much the copayments are very similar. They just changed by $5. Hospitalization on this plan is $500 per admission. Thank you. Oh, just to, that we do have a medicated microsite, and so you can log into that microsite and get information about Kaiser Permanente. Thank you again.
Excellent. Thank you, Marisol. A lot of great options for us. Who here has a need for eyeglasses and eye care? I'm one of them. Today from VSP, which is our vision care provider, is Paul Sontag.
Good afternoon, everyone. Thank you for having us. And as you can see, the benefits are listed. The in-network, you have a $10 copayment, 1 visit every 12 months, and out-of-network, which you don't need to go to, because like even at a shopping mall, you'll find a VSP provider. You just go in and say, do you accept VSP? They say, yes. What's the last 4 digits of your social security number? And you're in seeing the doctor. So you don't really need to go out of network, but there is the out of network available allowance, and that would be $51. Then you have the standard lens covered in full for the single, bifocal, and trifocal. The frames, once every 24 months, you get an allowance of up to $150 and 20% off amount above allowance. Out front, we have this sheet here, and you can see on the reverse side that Costco is also on the plan, and that has an $80 allowance because Costco is so large it can buy in bulk, so it sells it cheaper. Contact lens in lieu of eyeglasses is $150 every 24 months. The low vision is $500 maximum benefit. Laser vision correction is a 15% fee discount, and discount in extra savings you get $20 20% off additional glasses and non-prescription sunglasses. So out front, we have this sheet here that explains the benefits we just went over. We have, everybody loves these, the lens cloth cleaner, great for your glasses, sunglasses, and even your phone in your pocket. So they have VSP.com, and when you go to VSP.com on your phone,